Unvaccinated, unmasked teacher infected more than half of students in class with COVID-19. CDC reports it's a prime example of how easy it is to undermine efforts to protect children too young to be vaccinated. U.S. Centers for Disease Control and Prevention Director Dr. Rochelle Walensky said the teacher came to work even though they had COVID-19 symptoms and then took off their mask to read to the young students. A team at Marin County Public Health reported in the CDC's weekly report on death and disease. The teacher assumed the symptoms indicated allergies, not infection, the investigators found. And that's despite layers of measures intended to prevent transmission of the virus. The school required teachers and students to mask while indoors. Interviews with parents of infected students suggested that students' adherence to masking and distancing guidelines in line with CDC recommendations was high in class. However, the teacher was reportedly unmasked on occasions when reading aloud in class, the report read. Throughout this period, all desks were separated by 6 feet, it added. All classrooms had portable high-efficiency particulate air filters and doors and windows were left open. It wasn't enough to protect the kids. Eventually, 27 people, including the teacher, were infected. None were seriously ill and all recovered. Those cases that were analyzed involved the Delta variant of coronavirus, although the researchers said they were not necessarily able to test everyone who may have been infected in the outbreak. The CDC highlighted the case as an example of how schools need to follow all recommendations if they want to protect students and staff. The introduction of the virus into the classroom by a teacher who worked in school, while she was both symptomatic and unvaccinated and who was unmasked when reading aloud to a class, resulted in cases within the classroom, across the school and among families of students and staff and the community, Walensky told a White House COVID-19 briefing Friday. We know how to protect our kids in school. We have the tools. The CDC's guidance for schools lists vaccination as the #1 way to protect everyone. Vaccination is the leading public health prevention strategy to end the COVID-19 pandemic. Promoting vaccination can help schools safely return to in-person learning as well as extracurricular activities and sports. It says kids under 12 are not eligible for vaccination, and the CDC says it's important for the adults around them to get vaccinated to protect them. The outbreak at the elementary school was a heads-up to the county that the Delta variant was going to make it harder to prevent outbreaks, she said. Among the 5 infected adults, 1 parent and the teacher were unvaccinated. The others were fully vaccinated, the report reads. The vaccinated adults and 1 unvaccinated adult were symptomatic with fever, chills, cough, headache, and loss of smell. No other school staff members reported becoming ill. The county was able to conduct an intensive contact tracing operation that painted a good picture of what happened. Several children appeared to have been infected during a sleepover, and some from the infected teacher's class appear to have infected siblings. Testing of most of the children who were exposed was key, because many of the children never developed symptoms. The school was on point with all of their mitigation strategies, Santora said. I think if it wasn't Delta, I don't think we would have seen this. Nonetheless, the CDC concluded, schools can safely open for in-person classes if they take care. Los Angeles County officials studied cases in their schools from September to March. They counted 463 cases among students in the time that could be linked back to a school exposure, and 3,927 among staff who were back in person. This was a far lower case rate than in the community at large during the same period, they reported. In schools with safety protocols in place for prevention and containment, case rates in children and adolescents were 3.4 times lower during the winter peak compared with rates in the community, they wrote. This analysis reflects transmission patterns before the more transmissible SARS-CoV-2 B.1.617.2 variant became predominant in the United States. A multi-pronged prevention strategy, including masking, physical distancing, testing, and most recently vaccination of children and adolescents aged 12 years and above, will remain critical to reducing transmission as more students return to the classroom, they added. These findings from a large and diverse county present preliminary evidence that schools provided a relatively safe environment during the 2020-21 school year.
Thank you for watching. Please subscribe.